One of the advantages of having the digital technology we have in the practice is being able to utilize it for all facets of treatments. I'm Dr. Christopher Baer. I'm the owner of Baer Dental Designs here in Lone Tree, Colorado. I've owned the practice for about 15 years now. Baer Dental is a comprehensive dental clinic where we provide treatment for all facets of dentistry, ranging from basic simple filling to advanced dentures that are supported on implants. I've been an early adopter of digitization, so I started out scanning before it was cool, and we started utilizing that about 12 years ago. The digitization of teeth was something that I saw as a future, and it saves a lot of time and money, and the accuracy's improved over time. The whole reason and our philosophy at Baer Dental is to have treatments that are better for patients. I knew we could control a lot of the costs and the quality if we were doing it in-house. So we brought milling in-house about the same time we brought in 3D printing. Around 2017, we brought in the 3D printing with the Form 2 from Formlabs. We were able to utilize that to print models, and that was a lot faster, and it was more predictable. If you can scan somebody and show them what their smile is going to look like before they finish their hygiene appointment, is very impactful. So currently, Baer Dental, we utilize the Form 4B for all of our printing needs. We've got a Form wash and we have a form curing unit, and so we utilize those on a daily basis. I would say we're probably printing anywhere from 10 to maybe 30 prints a week. One of the reasons why we recommend the Form 4B is predictability. That's a very predictable printer, and when you look at 3D printing, it's not necessarily the initial printer cost, but it's the cost of all of those consumables that you're going to have. And Formlabs has done a wonderful job of making all of that affordable for people. The Form 4B has definitely changed how we work because we're able to do things quite a bit faster. One of my favorite things to print is going to be occlusal splints, especially with 3Shapes AI design. We can have a splint design back within 10 minutes, and you're able to print a splint in under an hour. So in under probably an hour and a half, you've got something that you can deliver to a patient. Because they're very accurate, we have less chair time to deliver, and they're also very affordable to print because the resin printed splints usually cost somewhere between $5 to $10 versus paying a lab. So if you've ever had a patient that's in pain, they're having jaw symptoms, being able to do something like that same day for them can be life altering. One of the reasons to utilize 3D printing in a restorative practice is to provide better treatment. You can 3D print a restoration, in under 30 minutes for them and have that ready to deliver. There's times too where if you have a trauma case, patient comes in, if you're lucky enough to have a scan of that patient beforehand, you can 3D print the model to be able to quickly reconstruct a temporary for them so that you can get them back to smiling. If you're looking at printing restorations, whether it's a temporary restoration or a final restoration, we have probably about a 50% time savings in doing that for our whole entire process. But with this particular patient, one of the challenges was we had some periodontally involved teeth. And so you're looking at, do you want to invest in a final restoration and go full bore to that when the patient's got bone loss, mobility? We don't want to spend thousands of dollars on restorations for 6 teeth when we're not sure of the survivability of these teeth. If we're looking at occlusion, you're trying to give the patient something that's aesthetic, something that's durable, and something that's affordable. You want to work out the occlusion before you go to the final restoration. So if you start to have that digital mindset where you're thinking, what can I do for the patient, and utilize all of the technologies that we have at the same time, making sure things are scheduled correctly in that process. With this case, we were able to 3D print the temporaries. They're the interim restorations, if you will, but we also have to 3D print a model to be able to make a night guard to deliver for him same day. Patient wears a CPAP and he needs to have a night guard to help protect the restorations because he's going to have the mask fitted and tightened to his face. He also has a history of clenching and grinding, so we want to provide something that's soft and shock absorbing to help prevent the wear and tear on those temporaries while we work out the occlusion. Having the digital technology to design all of that comes into play, because if you outsource it, you'd have to think about the time to outsource and maybe a technician to be able to do that. If you're looking at AI design, you can do bridges. So if you wanted to do a 3-unit bridge, you can have that submitted and then 5 minutes later submit the other bridge, so you get those and you can print them at the same time. Having the technology there affords you all of these options for treatment. One of the reasons why we love utilizing 3Shape is they have what's called 3Shape Automate, and it's an automated AI designed crown, and you can get that back in under 5 minutes. And so that's pretty awesome. That's generally faster than anybody's going to be able to train an assistant that has minimal experience. Even for all of our night guards, this year we've switched completely over to AI design, and so those designs take about 10 to 15 minutes to get back. We've trained assistants to be able to do 3D printing to manage all of the prints. So especially if I'm away, if I'm not in the office, the assistants can design, they can print, they can do restorations, get temporaries ready if we're doing something for a surgery. Looking back, I think people will only find that they're gonna wish they'd adopted 3D printing sooner, because all of the opportunities that it creates within the practice, it teaches your team to be digitally minded and look at things in a different way of what can we do to create a better experience for patients. Most patients tend to not want to be at the dental office anyway because of fear. If you can create an environment where you can scan patients and then you can provide restorations, or you can provide whitening trays, splints, all of that stuff within a short period of time, you have the ability to impact a patient's well-being far beyond anything that's any analog workflow that we've had.